My name's Jonas. I'm an Assistant Professor of Pediatrics at UCLA and a Pediatric Hematology Oncology physician with a PhD and background in material science and bioengineering. These are disciplines that rarely get to mix, but at a place like UCLA, I've got the unique opportunity to explore exciting possibilities to make a difference for my patients. This includes treating kids receiving stem cell transplants or new and emerging immunotherapies or gene therapies. My research really explores the intersection of pediatrics, hematology oncology, stem cell biology, and nanoscience. In my lab, we develop technologies to advance children's health and regenerative medicine treatments towards precision pediatric care. To reach this goal, my research group thinks about rapid, safe, and cost-effective approaches to deliver genetic engineering machinery into immune cells and stem cells for manufacturing cell-based therapies directed at cancers, hematologic disorders, cystic fibrosis, and other childhood diseases. In simpler terms, we want to really establish a biomolecular delivery surface that's really like how FedEx or Amazon works in our everyday lives. Developing these types of technologies will help us expand the reach of cell and gene therapies, which often cost hundreds of thousands, if not millions of dollars to produce and administer, placing them really out of the reach of many patients like the kids I treat, particularly those with rare diseases who could benefit from them the most. What continues to drive much of my efforts at UCLA is being able to quickly and effortlessly form research collaborations with experts across campus. Together with Dr. Bridget Gompertz, who's an expert in the stem cell biology of the human airway, and Dr. Donald Cohn, a pioneer in the development and clinical translation of gene therapies for children with primary immunodeficiencies, we're working on developing new gene therapy solutions for cystic fibrosis. Cystic fibrosis, or CF, is a genetic disease that affects the lungs and other organs. It's caused when there's basically a defect in the CFTR gene, which regulates the salt balance between cells in the body and is vital for forming the protective hydration layers that make organs function. When this gene is defective, the body's mucus-producing glands don't work normally, leading to chronic health challenges, including mucus buildup and frequent infections in the airway, irreparable damage to the lungs, and reduced lifespan. While treatments exist to help with the chronic symptoms of CF, there's really no cure for this debilitating disease. Current medications used to treat CF only work on certain common CF mutations, and roughly 10% of patients with CFTR mutations will not be able to respond to current therapies. It's also notable that these rare CFTR mutations tend to be more prevalent in historically underrepresented and medically underserved groups, which really underscores to us the need for developing gene therapies that can be more broadly applied as solutions for the patients who need them. Our work in cystic fibrosis so far has focused on leveraging the collective expertise of our multidisciplinary teams. Dr. Gompertz leads our efforts to identify stem cell populations of the human airway that offer the best potential for therapeutic gene correction. They're our highest value targets. She is now pushing forward to develop organoid models that mimic these areas of the airway. Dr. Cohn's lab focuses on the gene editing tools necessary to correct mutations that cause cystic fibrosis. And my team is really tasked with bringing it all together by designing nanoparticle shipping containers that can package these gene editing reagents and facilitate their transport to airway stem cell populations identified by Dr. Gompertz's team. We've already demonstrated success in the lab, loading our nanoparticle carriers with gene editing tools into these cells and inserting a new corrected copy of the CFTR gene that overrides dysfunctional copies of the gene in those cells. Even with the small amount of gene correction we've seen so far, we've observed up to 80% restoration of normal CFTR function. But to make this work practically for CF patients, we'll need to overcome barriers like the thick mucus that develops in the CF airway. We'll also need to ensure that the nanoparticles that we design and their gene editing cargo are able to reach the specific long-lived cells of the airway that, when corrected, would offer the best chance at finding a permanent cure. We hope that multidisciplinary efforts like ours will really inspire other groups to join the CF research community and help contribute to our collective goal of developing gene therapy tools that offer a definitive cure for CF. Also, because our delivery technologies are modular in nature, we're ultimately building a toolkit that can be applied broadly to other diseases treatable by stem cell and gene therapies for patients not just at UCLA, but everywhere. Along the way, we're seeking collaborative partnerships and support that can help us grow and advance our preclinical efforts and move these solutions closer into clinical practice. Thank you.